Hi, my name is Emily. I'm a family nurse practitioner student, and I'm here today to do a full head-to-toe assessment on you. I'm going to start by assessing your eyes. If you don't mind taking your glasses off for me. I'm first assessing to see that your eyes are symmetrical on your face, and I'm first looking at your sclera to make sure that it is white and there's no signs of jaundice or excessive redness. I'm now going to place my hands on your face and pull down on your lower lid so I can look at your conjunctival sac. And I'm going to shine this. Okay. I'm looking just to make sure there's no excessive tearing or excessive dryness. Your conjunctival sac is moist and reddish pink. Go ahead and look up to the sky, look down, look to your right, and look to your left. Okay, and just look straight at me. Your sclera is white with red vasculature, and there's no signs of edema or excessive irritation. I'm going to go ahead and look at your arm. I'm going to do the same thing. Okay, go ahead and look up, and down, to the side, other side. Okay, again, there's no excessive tearing or excessive dryness. You have white sclera, it's not jaundice or any kind of discoloration. There's no nodules, ulcerations, and the red vasculature is seen against your white sclera. Now I'm going to look at your cornea, lens, and iris by using oblique lighting coming from the temporal side. And as I do this, I'm looking to see that there's no opacities, that there's no shadow being cast by your iris, which would indicate glaucoma, and I can see that the markings of your iris are clearly defined. And I'm going to do that from the other side as well. Okay, there's no opacities. I can see the markings of your iris clearly, and there's no shadow being cast, which would indicate, again, glaucoma. I'm now going to assess your pupils, and in doing so, I'm going to assess cranial nerve number 2, which is your optic nerve. I'm first going to measure your pupils with this measuring thing on my pen light here. I'm going to make sure that they are equal, your right and left pupil, that they are both round, and then I'm going to test the reactivity to light. Okay, so if you just want to open up for me, I'm just going to see what size. Looks like you are about size 5 on that side, and about a 5 on this side as well. So they are both round and they are equal. Now I'm going to test direct reactivity to light, so I'm going to shine the light directly in your eye and make sure that your pupil constricts as I do that. Okay, it's reactive to light, also reactive to light. Now I'm going to test consensual reaction, which means when I shine the light in this eye also reacts. Okay, positive consensual reaction. Now I'm going to test cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. And to do this, I'm going to test your extraocular movement. So I'm going to make an H in the air in front of you, and I want you just to follow my hands with your eyes, okay? Without moving your face. Good. You followed all of my movements, so those cranial nerves are intact. I'm going to test for convergence, which means I'm going to bring my finger as close to your nose as I can. I want you just to follow my finger with your eyes. Okay, good. Now I'm going to test for accommodation. So I want you to look at my finger and then look at a spot in the wall just with your eyes, and I want to make sure that your pupils dilate, accommodating for that distance. So go ahead and look at my eye. Now look at a distance right behind me. Good. Now I'm going to visualize your eyes, your optic disc, and your cone of light, and your pupillary arteries and veins. So let me turn this light on. I'm only going to do this in one eye, and I'm going to do it in your right eye, and I'm going to place my hand on your forehead with my thumb out so I can get as close to you as I can without actually touching. Okay? First, I'm going to make sure that there's a red reflex. Hell if I looked in the right way, huh? Okay, red reflex is positive. And now I'm going to get close to you and look into your eye. Okay, I see your optic disc is round and orangish red. And I see your vessels and your arteries. The vessels are dark red, and the arteries are bright red, and the vessels are more easily visualized because they are about 3 times as large as your arteries are. Okay. Next is your head. I'm going to begin by just assessing facial symmetry. Making sure your nose is midline. Your eyes we've already determined are symmetrical, and your ears as well. I'm going to assess your skull for any dryness, scaliness, flakiness, any irregular contours. And also I'm going to place my hands on your head, and at the same time I'm doing that, I'm going to be assessing your hair distribution, any infestations, or any abnormal contours or nodules. Okay? Okay, there's no dryness or flakiness. You have a thinning hair with male pattern baldness. Few dry flakes in the back, but no nodules or masses of any concern. Now I'm going to assess cranial nerve number 5, which is the trigeminal nerve. And to do so, I'm going to touch you with this soft Q-tip, feels like that, in 3 areas of your face. Your ophthalmic, your maxillary, and your mandibular areas. And I want you to close your eyes, and when you feel me touching you, I want you to just let me know that you felt a touch, okay? Okay. Okay, very good. Cranial nerve 5 is intact. Now I'm going to test the motor strength of your masseter and your trigeminal. And so I want you to clench your teeth. Like, okay. I'm just feeling the strength. Your masseter and your mandibular. Okay, good strength. Now I'm going to assess cranial nerve number 7, which is your facial nerve. And to do this, I'm going to have you make different facial expressions. I'm going to have you go ahead and smile, frown, sorry, puff your cheeks out, and raise your eyebrows. Okay, very good. Now I'm going to move on to your nose, and I'm going to assess first your nasal patency. This is your cranial nerve number 1, which is olfactory. What I'm going to do is occlude one there and have you smell this thing that I forgot to have, and tell me what it is, and then we're going to go to the other one. Okay, so go ahead and close your eyes. Okay, I'm including this here. Go ahead and smell. Coffee. Okay.
Mm-hmm.
What is it?
Coffee.
Great. Now let's do the other nair. Smell.
Coffee.
Great. Now I'm going to look in your nasal mucosa. Whoopsie. That happened last time I did this too. Okay, and if I can have you put your head back a little bit, I'm going to look inside your nose. And I'm looking to see if there are any ulcers, polyps. I can see that your superior, middle, and inferior turbinates. Your nasal is not, or your septum is not deviated. And there's no bleeding. Look at the other one. Okay, can also see your superior, middle, and inferior turbinates. There's no polyps, and your septum is not deviated. Okay. Now I'm going to assess your sinuses. If I could have you take your glasses off for me, I'm going to assess your frontal sinuses, which are right underneath of your upper brow. So with my 2 fingers, I'm just going to palpate this area. Any tenderness or pain? There's no swelling. I'm going to lightly tap on my fingers. Any pain? Okay, and do the same on this side. Any pain?
No.
Okay, now I'm going to assess your maxillary sinuses. I'm going to place my thumb underneath of this area. Is there any pain?
No.
Okay, there's no nodules. Okay, now I'm going to assess your ears. Have you had any issues hearing lately, or any drainage or problems with your ears?
No.
Okay. I'm going to assess your hearing, so I'm going to stand behind you and occlude your ear by pushing on your tragus and whisper something, and I want you to tell me what I've said, okay? Okay, I'm going to occlude this tragus. What did I say?
3-4 dog.
Yes. Let me occlude this tragus.
I love kids.
All right. Was there any pain when I pushed on your tragus?
No.
Okay. Now I'm going to just pull your auricle up, back, and forward. Any pain there?
No.
Okay, I'm going to do the other one. Up, back, and forward. Any pain?
No.
Okay, good. Then that indicates that there's not any otitis externa. Now I'm going to press on the mastoid bone behind your ear. Any pain?
No.
Okay, good. That indicates that there's no otitis media. Now I'm going to take a look inside of your ear, and I'm going to visualize your tympanic membrane and the cone of light. I'm going to pull your ear down and forward. Okay, I see your tympanic membrane, and it is a pearly gray, and the cone of light is in the anterior inferior portion of that tympanic membrane. Okay, now I'm going to assess your neck, and by doing so I'm going to be assessing cranial nerve number 11, which is spinal accessory. And so first to do that, I'm going to place my hand on a side of your face, and I want you to turn your neck against my hand as I give some resistance. Okay, so go ahead and press again. Okay, and press it up. Okay, go ahead and shrug your shoulders. Shrug your shoulders. Good. Okay, now I'm going to check your trachea to make sure that it's midline. So I'm going to find your supraclavicular notch and move my fingers up on either side of your trachea and make sure that the same amount of space is on both sides of my hands, which there is. Your trachea is midline. And I'm going to come back around behind and find your thyroid gland, and by finding your tracheal landmarks. Okay. First, I'm going to palpate your thyroid cartilage. Okay, your cricoid cartilage, and your thyroid gland is down here. Can you go ahead and swallow for me? Okay. Any pain with any of those palpations?
No.
Okay. There was no nodules, no swelling, no issues with your thyroid gland. Now I'm going to palpate your lymph nodes, and I'm going to start, so that means I'm going to place my hands on different areas of your face, okay? And you let me know if there's any pain or tenderness. So your preauricular lymph nodes, your postauricular lymph nodes, your occipital lymph nodes, tonsillar lymph nodes, your submental lymph nodes, submandibular lymph nodes, your supraclavicular lymph nodes, posterior cervical lymph nodes, deep cervical, and superficial cervical. Any pain with any of those?
No.
Okay. Now I'm going to, there were no nodules, no swelling. Now I'm going to listen to your carotid arteries for any carotid bruits with the bell of my stethoscope. Go ahead and look straight ahead. Perfect. Okay, no bruises are noted. I'm now going to assess your thorax and listen to your lungs. And I'm first assessing your anterior thorax by noticing the symmetry with which you take breaths, making sure there's no accessory muscle use in your neck or in your shoulders, and none are noted. I'm going to now measure your AP to lateral ratio. So if you would just raise your arm out to your side, I'm going to come over here and with my hands measure your anterior posterior width. And come over to your lateral side and compare. So your AP to lateral ratio is about 1:2, which does not indicate any kind of barrel chestedness that would be seen in COPD. And now I'm going to measure your rate and rhythm of your breaths, and I'm going to do that by placing my hand on your posterior chest and watching the second hand counting for 15 seconds, okay? So just breathe normally. Okay, you're breathing about 16 breaths per minute at a regular rate. You're not in any kind of distress or having any shortness of breath or dyspnea. I'm going to auscultate your chest with my stethoscope to make sure there's no adventitious breath sounds. Go ahead and take a deep breath. Good. The sounds are clear and diminished in the basis, and there's no wheezing or crackling or rhonchi. I'm going to move over in your back to look at your posterior chest. And again, I'm just assessing for symmetry of movement, making sure there's no deformities or masses that are concerning, and there are not. Now I'm going to test for tactile fremitus, and so I want you to say 99, 99, 99 as I feel on your back, okay? So go ahead.
99, 99, 99, 99.
Okay. I felt the vibrations as you said 99 in all of the areas that I palpated, which means there's no consolidation in your lungs. Now I'm going to come down here to about your sixth intercostal space and press my hands on your back and go ahead and take a big deep breath and let it out. Okay. I was just checking to make sure that my thumbs moved symmetrically as you took that breath. Okay. Now I'm going to percuss your back in a ladder fashion, okay? your lungs are resonant throughout, which is normal. Now I'm going to assess for costovertebral tenderness, which otherwise known as CVA tenderness, and that's test to see if there's any kind of kidney disease. So I'm going to come down here to about your 12th intercostal space, which is right about where your kidneys would be, and I'm going to lightly thud. Let me know if there's any pain or tenderness, okay? Any pain or tenderness?
No. No.
Okay. Now I'm just going to listen with my stethoscope as I did on the front side. And again, I'm going to do this in a ladder pattern. So just take big breaths. Okay, lung sounds are equal throughout, clear, no adventitious lung sounds. They are a little bit diminished in the bases. Now I'm going to test for regophony, and what I'm going to have you do is say E, 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 as I listen with my stethoscope, and I should hear it stay a long E sound. If the sound at the end goes up to an A, then that could mean there's some consolidation. Okay, so go ahead and say E, 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 E.
E, 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 E. E, 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 E. E, 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 E.
Okay, very good. The E stayed the long E sound. So now I'm going to come back over to the front and now assess your cardiovascular system. And I'm going to do that by first assessing your carotid pulse. And I'll be grading your pulses on a scale of 0 to 4. 0 obviously being having no pulse, 4 being bounding, 3 is normal, 2 would be weak and thready. So I'm going to assess your carotid pulses one at a time. Okay, it's about a +3, it's regular. Okay, +3, also regular. Now I'm going to assess simultaneously your brachial artery, Okay, your regular and a +3. Now your radial arteries. Okay, +3 in the regular. I'm just going to have you kind of bring your feet out here like this. I'm going to assess your posterior tibialis arteries, or pulses rather. Okay, +3. Now your dorsalis pedis, which is down here on your foot. Okay, those are also +3 and regular. Okay, now I'm going to have you lay down, and I'm going to listen to your different heart sounds, okay? Okay. I'm first noticing if there's any heaves or thrills. With the pads of my fingers, I'm just going to feel your chest for any heaves, which would be any turbulent blood flow. Okay, now with the palm of my hand, I'm going to assess for any thrills. Okay, none of which I feel. Now with the diaphragm of my stethoscope, I'm going to listen to the different landmarks of your heart, and I'm listening for any extra heart sounds, any murmurs. Okay, the first space I'm going to listen to is your aortic heart sound. Okay, I hear S1, S2. I'm going to go straight across to your pulmonic. Okay, move down tricuspid. Okay, S1, S2. Herb's point. And the mitral valve. Okay, I'm also going to find the point of maximal impulse, which is at the apex of your heart. And I'm going to count your heart rate. Okay, your heart rate is about 70. S1, S2, no extra heart sounds and no murmurs noted. Now I'm going to listen to your to Erb's point, tricuspid, and the mitral valve with the bell of my stethoscope for any murmurs. Okay, I'm going to come over here to Erb's point. Okay, no murmur noted. Tricuspid. And mitral valve. Okay, good. No murmurs or extra heart sounds. Now I'm going to assess your abdomen, and I'm just going to do that by getting down level with your abdomen and assessing for any visual peristalsis, any hernias, any just abnormal contours, which none are seen. I'm just going to raise your shirt up so I can visualize your belly. Okay, now I'm going to use my stethoscope, and listen to the abdominal arteries. I'm going to start with your aorta, your aortic, abdominal aorta. Okay, renal. Iliac. And femoral. Okay, good. Now all four of your quadrants. sounds are active in all 4 quadrants. Now I'm going to percuss. I should hear timpani. Good. Now I'm going to measure the span of your liver, and I'm going to start at your belly button and percuss up your abdomen until I hear dullness, and that will be the bottom of your liver. And then I'll percuss down from your chest until I hear dullness, and that will be the top of your liver. Right there. Now I'm going to calm that down. Okay, right there to right there. We're going to pretend I have a measuring thing. We're going to say it's about 6 centimeters, which is normal. Now I'm going to confirm that or validate that with the liver scratch test. So I'm going to place my stethoscope on your abdomen and scratch while I'm listening and listen to the change in sound. Yeah, right there. Right there. Okay. Now, there's any pain. Any pain?
No.
Okay, now I'm going to do some deeper palpation. Any pain?
No.
Okay. Now I'm going to palpate your inguinal lymph nodes, your superior and your inferior. So just let me know if there's any pain, okay? This would be your superior. Any pain?
No.
Okay. Your inferior lymph nodes. Any pain?
No.
Okay. On the other side. Got your superior lymph nodes. Any pain?
No.
Inferior inguinal lymph nodes. Any pain?
No.
Okay. I'm going to do a couple of special tests. The first one is called Murphy's test, and this is to test for cholecystitis. In the upper right quadrant, I'm going to deeply palpate, and you take a deep breath in, and we'll see if there's any pain. Okay. So go ahead and take a deep breath in. Any pain?
No.
Okay. Now I'm going to do McBurney's point, and that's testing for appendicitis. I'm just going to do some palpation. You let me know if there's any pain, okay? Any pain?
No.
Okay, it'll be a negative sign. Now I'm going to do Brudzinski's sign. This is testing for meningeal irritation. So as you're laying flat, I'm just going to have you bring your chin up to your chest. Any pain?
No.
Okay. Now I'm just going to have you bring your knees up. This is Kiernig's sign, both of them. Any pain?
No.
Okay. Good. Okay. The last thing that we're going to assess is your musculoskeletal system. So if I could have you stand up for me. I'm going to start by just assessing your gait, the way that you walk. So go ahead and just walk from here to the counter and back. I'm just assessing the ease with which you walk, your stride, the way your arms swing. There's no jerkiness or irregular movements. Now I'm going to have you tandem walk, which is where you put your heel toe, just walk there and back. That please. Just assessing your balance and the ease with which you make that movement. Okay, come on back. Now I'm going to have you walk on your tiptoes. You don't have to go as far. And walk back on your tiptoes, please. Again, assessing balance and strength of your ankle joint. Okay, and lastly, I'm going to have you walk on the heels of your feet. Okay, and back. Okay. Now we're going to do some range of motion with your head. I'm going to have you flex and extend your head, so head to your chest, and extend it back. Look up to the ceiling. Good. Now bring it back to the center. I'm going to have you rotate it. Look at each shoulder. And then the other shoulder. Okay, now back in the center. And have you bring your ear down to your shoulder like this. Now the other side. Good. We're going to assess the Romberg test. So I want you to put your feet together. Okay. Now I'm going to have you close your eyes, and I want you to stand as still as you can. We're going to do this for about 20 seconds, just so I can assess your balance. Good, you're staying very balanced and steady. You can open your eyes. Now we're going to assess range of motion of your shoulders. So I'm going to have you bring your arms out like this and up to the ceiling. Okay. And down. Now I'm going to have you extend them back. Good. I'm going to have you cross. Okay. Now I'm going to have you reach back up to your shoulder blade for internal rotation. Other arm, please. Okay, now come up like a stop sign. Okay. Good. Next, we're going to assess the range of motion of your spine. So I'm going to have you flex forward and touch your toes. Okay, good. I'm going to have you extend back as far as you can without falling over. Okay, good. I'm going to have you rotate this. Good. Okay, good. Now we're going to assess for scoliosis. So I'm just going to stand on this side of you. If you want to face this way, go ahead and bend down forward and as far as you can. And I'm just assessing the curve of your spine and looking to see that your shoulder blades are evenly raised and one is not higher than the other. And I do not see any evidence of scoliosis. Okay, you can go ahead and stand up. Now I'm going to have you lay down on the bed again, and we're going to assess some different range of motion. First, we're going to assess the range of motion of your hips, and to do so, I'm going to place my arm underneath of your hip here, and I'm going to have you raise your knee up to your chest. Okay, any pain?
No.
Okay, go ahead and do the other one. Okay, now I'm going to have you extend your leg off of the edge of the couch, just like that. Okay, any pain?
No.
Okay, go ahead and do the other one. Okay, now I'm going to test abduction and adduction of your hip, and I'm going to have you adduct, put this leg out straight, and
Okay.
I'm going to have you adduct it and bring it towards me. Any pain?
No.
Okay, now go ahead and abduct it and bring that leg out. Okay, good. Go ahead and bring it back and do the same with the other leg. We're going to adduct, bring it towards the middle. Okay, now do abduction and bring it out this way. Okay. Now I'm going to test your MCL, ACL, and PCL and LCL. And to do that, I'm going to have you bring your knee up like this. I'm going to place my hand, just at a 90-degree angle, on your ankle and on your knee, and I'm going to stress this this way. Any pain?
No.
Okay, I'm going to go the other way. Any pain?
No.
Okay, let's do it on the other leg. Okay, I'm going to bring your leg medially. Any pain?
No.
Okay, that was your MCL. This is your ACL. Okay. I'm going to do the anterior and posterior drawer sign. I'm going to flex your knees 90 degrees and cup your knees with my hand. And I'm going to draw them out. Okay, there's very little movement there, and I'm going to go the opposite direction. Okay, do that on this one. Okay, that's it. Okay, now I'm going to test dorsiflexion and of your ankle. So go ahead and push against my hand with your ankle. Okay, I'm going to push back against it. Go ahead and flex it up. Okay, let's try the other ankle. Go down and up. Okay, great. Now I'm going to test the strength of some of your muscles. So you can go ahead and sit up. I'm going to test the bicep and tricep muscle first. So I'm going to have you bring your arm out here like this, and I'm going to push down. I want you to resist. Okay, good. I'm going to push up, and I want you to resist. Okay, good. Now I'm going to have you bring like this, and I'm going to push up on your wrist, and I want you to resist. Okay. The first two were about a +5, and this one is about a +4. And resist me. And that's a +5. Okay, now I'm going to test your grips. So if you'll go ahead and grip my as tight as you can. Okay, it's about a +5. To test some of your reflexes. And the first reflex I'm going to test is your triceps reflex. I'm just going to have you put your arm right here like this, and I'm supporting your shoulder here. And I'm going to tap above your elbow. Okay. Now I'm going to test your brachioradialis reflex, and about 2 spaces above this joint right here, I'm going to tap. Now I'm going to test your patellar reflex. Can you scoot back a little bit so your foot is, there we go. Oh, that doesn't help much, does it? Okay. We'll test the other one as well. Okay. To dorsiflex your foot and strike your Achilles heel. Okay, now I'm going to do the Babinski sign. All right, good. That was a negative sign because your big toe did not extend in an abnormal way. So thank you for allowing me to do a head-to-toe assessment on you today.